again, Amanda's kind of caught me out here. She's given me two themes to very quickly respond to, and I'm conscious of the time that we've got. So we're not short of data. We've got a lot of data in our system. We're not particularly good at how we use it and orchestrate it. And we're going to work together. That's one of the themes around the ICS, that if we work together. So we've got two parts that we're going to work together. So we're going to integrate our services. And by that, every time we see somebody, if we use that information to support that individual, we can learn about how to help that individual, but we can also learn about how to help other individuals with similar types of conditions. And what we know is that the more we learn about that, the more we use our data, the better we can get at predicting and preventing disease. And this is already happening in some parts of our system. And what we're trying to do with the digital strategy is scale that up across the system. Just a general point on the strategy. The strategy is just the first part of this story. Coming together today, we want to take the 5 themes and develop a plan. We've made a commitment to the ICS board that we're going to go back to them with a plan. And actually that plan should be the culmination of all the things and energy that comes on in the system. So we're on to the really exciting one. And as he's coming up, just to build on James's point, and some of you will have seen me using this. So this is a computer that costs about the same price as 3 apples. This has the equivalent computing power of a desktop machine 20 years ago. And it can do all sorts of wonderful things. And it really epitomises what you were saying, James, about how stuff's changing so quickly. And I accept your points around this, Nick. But there are situations where we're going to need to adapt and change to technology that's happening around us. So I'd like to introduce you to Dominic Cushnan, who leads on Horizons Technology Endeavours programme. Sure. For those of you in the room, and I'm looking to Alistair over here, this is the man to talk to about artificial intelligence.
No intelligence inside
well, no,
my head,
well,
so
maybe not, but he's downloaded himself to a computer.
If
maybe.
only I could clone myself.
But he's also an expert around hacks as well, and I'm really pleased that he's come today. Thank you.
Thank you very much. Well, look, I only have a little bit of time, and I'm conscious that we're also going over a little bit. So, the first, grab the clicker. Yeah, no worries. First thing I want to do is, through this presentation, I'm going to give you the opportunity to do some doodling. So if you were planning to doodle anyway and not pay attention, this is your opportunity to have permission to do it. And what I want you to do, there's some paper on your table, in the middle of the table. If you grab your pens and papers and some pencils, what I want you to do over the next couple of minutes, just while I have a little bit of a ramble, I want you to do 12 little doodles. Something similar to this. Nothing too complex, don't overthink it, and write your name on the piece of paper. Now, when we're thinking about creating the future, I got thinking about, there's a strategy term called the 3-box solution, and we talk about box 1, which is the today, the second box is about the past and forgetting the past, and the third box is about the future. And I think what we find ourselves in is always thinking about creating efficiencies and the economic things that we need to do today in box 1. But what we need to do is think about what are the things that we need to forget, what are the inbuilt memories and the bad experiences that we've had around technology over the last couple of decades, and how we can rethink about that and build a vision and an opportunity for the future. And it made me think of this book. I don't know, has anybody ever seen this book before? This is the Osborne Book of the Future. Brilliant, a couple of hands. So this is from 1979, and what I really loved about this book was it said that this is a trip to the time of the year 2000 and beyond. Now, they were very optimistic and utopian about the type of things that we were able to do. And I'd like to pull out a couple of things. One of the things they talk about in medicine is the idea that man and machines are working together. Now, somewhere along the line, we've seemed to have changed the dialogue around that. We've become quite anxious about what artificial intelligence means for us, what robotics means for us, what wearables and big data and all that means. But actually, what is it that we're actually trying to do, both for ourselves as individuals, for citizens, and as a collective health system? And they talk about the fact that humans going off to do the things that they're really good at and allowing us to go and explore the Earth. Now, I see that a number of people have already completed their doodles. So what I want you to do next is, and I'll come back to these slides in a second, is I want you to draw a bird. So first of all, sorry, I should say, swap the paper with someone across the table with you. So swap that around. And what I want you to do, just for a minute, while I keep rambling, is I want you to draw a couple of things. I want you to draw a beak, 2 legs, and a tail. So look at the doodles that you've got in front of you and see if you can pick out some themes there. The other bit as well is that back in the late 70s and 80s, we started thinking about what does technology and innovation mean for us and where is it that we're going to. And I think there's an opportunity for us to, not just today, but going forward, think about where are we actually going to. You know, what is our 10-year plan? What's our 15-year plan? What is the role of the patient? What's the role of us going forward? And does anybody know what this is? Can anybody see that? Any clinicians in the room? Anybody that worked on? Sorry? Close? Scurvy, yeah. And I think what we have to remember is that although there's an exponential rate in what's currently going, the environment is really complex today, whereas compared to back to 1601, where the first study of the use of lemons to help scurvy, it didn't actually get adopted by the Royal Navy for another 200 years. So I think there's a round of applause and a credibility to yourselves about where we've managed to get to in such a short period of time. If we look at what's happened in the last 20 years alone, you know, Google was set up their homepage. You know, it was the first time you were able to get access to the wealth of information online. And we also have the iPhone and the advent of smartphones. The clock's not working. So the other thing as well is that this is Jeremy Hyman's and Henry Tim's work that looks at how old power and new power is changing the way that we do things in the world. So traditionally, you know, we have power held by a few. We've got organizations that are controlling a lot of things, and it's command and it's leader-driven. We go to the points earlier on about our colleagues who are doing this leadership work. Actually, the things are changing. You know, we're getting to a point where it's about networks and cross-working across multiple organizations. And as Horizons, what we tried to do is we tried to create agency and autonomy for both individuals, but collectively, when we're thinking about change, how can we start thinking about how we can work together and not necessarily seek the permission, but go and speak to our colleagues across all parts of the health system. And an example of where patients are taking this into their own hands is the websites like Patients Like Me, where they're now starting to fire their doctor. You know, patients are going in and saying they no longer want to work with that doctor. They've spoken to their peers. They want to go and get the best access to treatment, and they want to get in the best pathways. And I think we have to recognize that that demand is coming through, and it's been quite clear in terms of what was discussed this morning. This is just a reminder of this. I don't know if everybody has seen this slide before, but instead of risking anything new, let's play it safe by continuing our slow decline in obsolescence. And I think that goes back to our internal cultures about risk and what we're trying to do. Where are we trying to actually get to? So let's think about where are we overall trying to get to with this. There's a couple of last points I want to leave with you. This one is a piece of research by an organizational network analysis organization in Denmark. And what they've discovered is that within any organization or in any system, only 3% of people in that organization will influence 85% of everybody else and the conversations. And I think that's something that we have to bear in mind when we're thinking about this type of work. Who are the influencers that we need to work with, be it on the front lines or be it on the boards, to make sure that they're engaged in our conversations? And what we have to bear in mind is that they're not always at the top of the organization. They're across the entire, up and down and across. And for that in mind, what is the story that we're telling them? Because they will have a very, very major impact on the success of your program of work. I just wanted to say, how have you got on with drawing your doodles and drawing some pictures? So the reason I do this is that it gets us into creative space this afternoon. We've got a number of workshops and things like that as well. But also we have to remember that as humans, we have the ability to find patterns. You know, we've talked about a lot of the signals, the weak noise that's currently coming, not just from healthcare, but across many industries, not just technology. And what's really fascinating about that is that we're then able to start thinking about how do we start thinking about embedding this into our strategies and into our programs of work. So I want to thank you very much for your time. I want to also thank Declan and the team, because I think their leadership abilities and the ability to bring us all together is really testament to this program of work. Thank you.
Dominic, want to stay up just in case? No, stay up. So, would anybody like to ask Dominic a question? I know we're running tight on time, but it's just such an interesting area. Tom, don't talk about pigeons.
I'm a radiologist, I'm not going to ask anything about imaging.
Sure, please do.
Where do you see AI going? What do you think is going to be the next thing we're going to be using with AI apart from relating to imaging?
So So I could talk about this for hours, and I think it's one of those things about predicting the future, right? It's quite difficult to do. There are a number of signals about what, specifically around medical imaging and the opportunities to optimize workflow when we're dealing with the images that are coming through. There's also other opportunities about how we're dealing with education, how we're enabling people to go and find the right resources and information, delivering pathways that are automated based on the latest research. And I think we also need to think about not just the sexy, interesting stuff, but the uncool stuff, the stuff that is all around how do we make sure that we're matching people up in the workforce to the right services. But you know, this is all kind of, at the moment, theoretical, and the academic health science networks, if you're not familiar with it, are doing a major piece looking at what's currently happening with machine learning and deep learning in this country, where are the clinical trials happening, what's going on, and they're pulling a report together that will hopefully come out for NHS Expo. So if you want to be involved with that, either connect with myself or connect with the HSN network. They have links to all this information, because I think one of the things that we can't do from a policy perspective is we can't know how to move forward unless we know actually what's currently available today, because we are in a box one solution of trying to create efficiencies of. Yeah.
Okay, so there is a fifth theme within our strategy, which is about how we're going to engage with people like Dominic, people in academia and other parts of the system, and really start to create some energy and change around this. Some of you will know that my son's currently in Manchester Children's Hospital, and he's been sitting there quite a lot over the last few weeks. And I noticed the nurses have a Vocera button. I don't know if any of you know what Vocera is, but it's like a call button that you can do things. And I thought to myself, I wonder what would happen if you put an artificial intelligence client on the end of the Vocera thing. So not only could you call the porter to come and collect the patient, you could do all sorts of other things. So I think, Nick, picking up on your question earlier, a lot of what we need to do lots of things in lots of areas. All these 5 things, we can't do them on their own. It's a combination of things. And I do think the artificial intelligence, 3D manufacturing, genomics, precision medicine, all those things are going to have a big influence on our future planning. And we have to take notice of them, because the top and bottom of it is we can't get the workforce. And it's going to get worse post-Brexit. So we need to start to think to do things differently.